pleased to be joined today on Health Beat by Dr. Enas Al Zaghal, an endocrinologist with Faith Regional Physician Services Endocrinology in Norfolk. And we're talking about gestational diabetes. So Dr. Enas, tell us some of the symptoms of gestational diabetes and how it's treated.
So basically, most women will have no symptoms, like warning symptoms for gestational diabetes. And that's why every woman, like pregnant lady, should have like the test, which is OGT test, between the 24th and 28th weeks of pregnancy. Unless patient has history of gestational diabetes before, like in her rare pregnancy, or she has risk factors like family history of type 2 diabetes. In that case, she might have the OGT test, which is oral glucose tolerance test, as early as her first prenatal or like, basically prenatal visits.
I see.
And the way that they do it, it's like giving like the pregnant lady and high sugary liquids, check her blood sugar before and after. And then we can detect the gestational diabetes. So risk factors, or the problems can happen to the mother if she has gestational diabetes, would be premature delivery or uncontrolled blood pressure and preeclampsia. And that's one of like kind of signs or symptoms, or we can call it more complication associated with that. Also having like too large baby, which leads to more complications such as like birth injuries due to be like, for the, the baby being stuck in the birth canal. And that's why like, surgeries will be indicated and having cesarean like section for that baby to be born. Yeah. Having high blood sugar in women will also like, and having uncontrolled gestational diabetes will also can lead to serious complications such as stillbirth. Also, like for the newborn, he might have more risk to have jaundice or breathing difficulty, as well as hypoglycemia, which is basically because of the exposure of for high insulin level during pregnancy if her blood sugar was uncontrolled. Treatment of like gestational diabetes will be healthy lifestyle, healthy diet, and losing weight, and as well as medications such as insulin if healthy lifestyle wasn't helpful.
Well, thank you so much for being here today. We appreciate it.
Thank you.
Right. To learn more about clinic locations, specialties, and providers, visit frpsclinics.org.